April is Head and Neck Cancer Awareness Month, something quite honestly few of us may think about, but we really should, especially when it comes to prevention. That's our conversation this morning with Dr. Marcus Wagner, a radiation oncologist at CHI Memorial. Nice to see you this morning.
Good morning.
I want to begin by talking about your specific role. You are a radiation oncologist, but we've had Memorial Hospital and various components of them on our show so often. And the thing that strikes me is the team approach that you bring to your practice. So you are just one of many physicians looking at your patients on an ongoing, regular basis.
Yeah, we're very blessed in this community to have some very high quality oncologists that takes care of cancer patients. So very blessed.
So we're going to focus on generalities in a way, head and neck, meaning the regions of the body where these particular cancers are found. Oral cancer is just one component, right?
Yes.
Of the cancers we're talking about. It's something that you sometimes find just by happenstance?
Yeah, so head and neck cancer, of course, being cancers of the mouth, behind the mouth, and in the throat area. Symptoms that, if you were to have cancers in any of these areas, might involve dentures that just didn't fit right, a persistent sore in the mouth area, redness, or some sort of other discoloration in the mouth, some sort of feeling of a lump in your throat, or trouble swallowing, or painful swallowing. A neck nodule that just doesn't seem to want to go away, or even ear pain, can all be symptoms of head and neck cancer. Of course, these are very similar to just the common cold, and I think everyone at home should understand that with the common cold, those symptoms should go away after a couple of weeks. With cancer, those symptoms won't go away. And so if any of those things persist, go and see your physician so they can get a more thorough exam and discuss potential treatment options.
And you even said, don't be alarmed, because no one wants to jump ahead. What's the medical phrase? If you, something about if you hear hoofbeats, don't think it's a zebra, you think it's a horse or something like that. What's the phrase I'm thinking of?
In general, just common things are common.
Right.
And so the common cold is quite common, and it might just be that you need some antibiotics, and hey, that's no big deal. A little bit of antibiotics and a return to your doctor in a couple of weeks is very often all you ever needed. But if there is something more there, then it's so much better to have a cancer, if it's to diagnose this early, so that you can treat it when it's nice and small, and have a much better chance of cure. It's
also a good idea, you said, when you're at the dentist's office, often these things are detected because so make sure you go to the dentist every year.
Yeah.
Twice a year.
Oral care is very important, not just for checking out, of course, head and neck cancer, but there's a lot of health conditions that are involved with poor dentition. And so, very important. It's
more prevalent, I think, than a lot of us realize. You said some 60,000 Americans every year who were diagnosed?
So 60,000 Americans every year will be diagnosed with head and neck cancer, and that involves about 3% of all cancers. So it's not like breast or prostate cancer and on the news all the time, but it does occur. One famous celebrity, Michael Douglas, was diagnosed with it not too long ago. And he underwent the treatments, and you can tell with trained eyes that he did have treatment. There's a few different characteristics you can see. But he's a good example of someone who got appropriately detected, got it treated, and now is able to continue his acting career.
Okay, and you were able to provide us kind of a look at where in the body, where we're really talking about, because you said sometimes these cancers can be in the gum line and in the mouth itself, but sometimes they're behind your ear? Yeah,
and they're all the areas that involves kind of the upper airways as well as the digestive tract above the neck. These are all areas where cancers can arise. Most commonly, if you're going to, it kind of depends on what the cause of the cancer was as to where they're occurring.
Okay, so let's talk about that. There are sort of two main focuses. Smoking is one. In all types of cancer, smoking is just a taboo problem.
Yes, if there was a magic wand that could help everyone at home to stop smoking, I would love to be able to do that. But it's hard. Stopping smoking is very hard. Somewhere around 9 out of 10 patients who get head and neck cancer, traditionally at least, will have had a smoking history, be it cigarette smoking or cigar smoking or even chewing tobacco. So all these things put you at risk for cancer as well as many other cancers and health conditions. So it's one of the best things you could ever do for yourself is to stop smoking.
Okay, also the HPV virus is linked to it, and you were talking with me quite candidly that you're aware there's been some questioning and controversy over the vaccines that are now touted to prevent the HPV virus.
Well, so now, like I said, smoking used to be the main cause of head and neck cancer. We've actually been very successful in the United States in helping people stop smoking. So now, over the past couple of decades, this HPV virus, which is the same virus that's involved with cervical cancer and some other cancers, the genital tract as well, it is now the main cause. And so, luckily, we actually now have a vaccine that helps prevent ever being infected with this virus. It's best, if, like other vaccines, if it's administered at a young age, usually around age 11 or 12 years old, but could be as early as age 9 and as late as age 26. And so it's important subject to talk about with your pediatrician or your family practice doctor about the use of it, because it's a crucial tool in stopping you ever being infected by the virus and ever even having a chance of having that cancer occur.
So the prevention side of the conversation is an important one to get out. But for many people watching today, perhaps they have a new diagnosis, and so they're saying, okay, I can't prevent, how do I treat? Each one is a case-by-case basis.
Well, again, I think the main principle is that if you catch cancer early, then it's a lot easier to treat. And I think there's some unfortunate information that tends to go around the web that maybe if you just were to take some sort of natural medication or alternative medication that the cancer would just go away. I wish that were the case. I promise you, I wish it were the case. But cancer just doesn't go away. That's not the nature of cancer. But again, if you catch it early, then you often just do a small surgery and have you get back to regular life. If it's more advanced, then it involves me getting involved. That's with radiation therapy or with the chemotherapy as well. And that's often like if there's lymph nodes involved and whatnot.
And that's where this team approach that they bring to you at Memorial is so incredibly wonderful, because literally there's a group of doctors sitting around discussing patient A and sort of brainstorming in a way over what's the best course of treatment, because each of you specialize in a different way to help, and you reach them in common consensus.
Yep, and we call these multidisciplinary tumor boards. And Memorial Hospital is one of the leaders in this region to do that. So all the different kinds of physicians, radiologists and pathologists and chemotherapy doctors, radiation doctors, surgeons are all coming together, working out the best possible diagnosis and management for the patients so that we can have the best hope for cure. The
best thing we can hope for is that no one watching today is in this position to need Dr. Wagner's care, but if you are, that would be your hope too, right?
Absolutely.
But if you are, you can find him at CHI Memorial. The phone number where you can reach him is 495-2258. Always consider checking out their website, memorial.org/cancer. Thank you so much.
Thank you for having me.
We're back after this.